What's up, everybody? This is Dr. Zach Baker. You are listening to the Strength and Knowledge Podcast. And today we have R2P sports resident Dr. Asher Roberts with us doing his monthly research article review. And in the month of December, we were looking at the foot and ankle. So the residents need to go out, find a journal article that is related to that body part or related to an injury with that body part. And that's what Asher's done for us today. And I believe we have an article on something along the lines of footwear and running. Asher, what did you find for us?
Yeah, so the article is a bit of a mouthful. It's a systematic review on the role of footwear constructions in running biomechanics, and basically looking at the implications for running-related injury and performance. Basically, does what we put on our feet affect how we run and our risk of injury?
It's a pretty cool article in the sense of it's a topic that is much more top of mind now than what it may have been 10, 15, 20 years ago. And if you look at the footwear market, there is no shortage of shoes out there for runners. It's a massive market. There's a lot of money involved in it. And there's some things that are extremely scientific in nature in regards to the design of the shoe, the proposed intention, and how that is going to influence that runner's experience. But then if you work with runners, you're also going to realize some of it's just personal preference. And I've worked with a lot of runners where maybe their anatomical presentation would lend you to suggest a certain type of footwear, but they don't like it. They don't like how it feels. They don't like how they move in it, and they have a preference for something else. So footwear is always a very interesting topic. And I'd be curious to see what the article found in this when we're looking just under the lens of, can shoes alter the biomechanics with running? Then we got to have the fun discussion of, does it matter? Does it matter? Or more importantly, how does it matter as a clinician? So, Asher, if you don't mind, kind of deep dive into the article. Let us know, what they were looking at and then what they found.
Yeah, so the article was a systematic review. So it was looking at 63 different articles with a running population of mostly male, and they're like 20s to 30s, all with varying foot strike patterns. You got heel strike, like midfoot, and then forefoot. Let's see. So when they were diving into this, they basically looked at a variety of different shoe constructions. Originally going into this, I was like, oh, maybe they're going to look at like your Alpha Fly Next Percent, your like top flight Nike shoe that was used in the Breaking 2 ultra like marathon, versus more of like your like minimalist barefoot. But they really just delved more into general construction of shoes. So they looked at a variety of things. They looked at shoelace style, shoe midsole, heel flare, heel toe drop, just minimalist shoes in general. This thing called the Masai Barefoot Technology, or MBT, whether or not you use a heel cup, shoe upper, and then the general stiffness of the shoe. So a lot to cover here.
Nice. And for those who are unfamiliar, typically when you're looking at a shoe, you can categorize it into one of three categories. It's either going to be a neutral shoe, which is kind of your basic shoe construction. It can be more of a stability or a motion control shoe, or it can be something that's more of a minimalist style shoe. And the easiest way to kind of conceptualize that, if you're unfamiliar with it, is your motion control, your stability shoes. If you were to take that shoe and you were to try to bend it in half or twist it and turn it, it would be very difficult to displace. It's got a lot of structure to it. So its goal or its job is to provide a very good foundation for the foot. You'll commonly see that referenced in people who may have instability or they may have some sort of anatomical deviation. Think of like a very high or very low arch, that they are looking for some sort of influence from the shoe to best support that and contour to their foot. On the opposite end of the spectrum, you have that more minimalist style shoe. These are the shoes that when you pick them up, they often tend to be very light. They often tend to have a very thin sole to them, or a non-bulky type look and feel to them. And you can usually fold them in any way, shape, or form that you want. You can wring them out like you're wringing a towel. You can touch the heel to the toe. And it's something that is designed to act as a cushion and a barrier between your foot and whatever surface you're contacting, but you're really relying on the structure of your own foot and ankle to bear most of the weight and provide most of the forces upon impact and propulsion with gait, running, walking, etc., and then your neutral shoe somewhere in between. Now, within each of those categories, you can get even more specific, and you can look at heel drop, and you can look at the height of the back of the shoe to the front of the shoe. You can talk about what the actual heel cup or the heel supports look like. You can look at, is there more medial or lateral support to the shoe? So there's a variety of different ways you can kind of tinker with it from there. But just to give you a premise of what some of your basic shoe constructions look like. So now, Asher, I believe in this article they kind of categorized these. All right, did the shoelace configuration change anything? Did the shoe midsole influence anything? Do you mind talking about when they put them into these different categories, what did they find within each category in regards to its relation to biomechanics?
So for a lot of the categories, not much, admittedly. With a lot of these things, it really seem like it comes down to runner preference, which, as you kind of alluded to earlier, is the biggest thing with runners. Is it comfortable when they run? There were a couple of things where there were some more firm findings, things that we can kind of take into the clinic and give recommendations to patients with. The first of those was really the shoe midsole. This had more of a higher article count. 19 of the 63 articles were actually looking at shoe midsole. And really what they found was the harder the midsole, the less energy loss. So you're going to be a bit more efficient with a harder midsole, whereas if you have a softer midsole, you might be using a bit more energy, but it's going to protect against those more impact-related injuries. So if you have someone who's struggling with impact, maybe has a bit more sensitivity in the heel, you might want to recommend something a bit softer to them. The other big one they looked at was your heel-toe drop. Really, they found no significant injury risk difference between different heel-toe drops. But if you have a zero drop shoe, it's going to improve more of your stiffness. So you're going to be a bit stiffer with push-off, which kind of makes sense. And if you're doing barefoot running, you're going to have even more stiffness, which, intuitively, that kind of makes sense. Minimalist shoe was the other heavy hitter. 18 articles of these 63 were looking at that. 3 of those studies showed that minimalist shoes improve running economy. They encourage more of that forefoot strike, which we know is more biomechanically advantageous. For some people, it might not be as comfortable, so they might not do it, but it is going to improve that running economy. 3 other studies showed that minimalist shoes increase the cross-sectional area, stiffness, and impulse of the Achilles tendon compared to your conventional shoes. And what they also found was that minimalist shoes can lead to hypertrophy of the abductor hallucis muscle. So, interesting if you want to work on some hypertrophy of that guy. And then heel cup was the other one that found something kind of significant. Only 2 studies really looked at that. And a heel cup is more of like a customized heel cup to kind of reduce plantar pressure, stress, pain, all that good stuff. They found that it does tend to reduce a bit of pressure and stress on that plantar fascia area.
Nice. Now, getting through this article, what are some of the big conclusions that you found, or what were some of the big takeaways that you'll really go into the clinic with?
Yeah, so basically the questions I get a lot in the clinic are like, hey, I'm running in this shoe or this type of shoe. It's more of a stiff shoe. It's more of a cushiony shoe. Like, what does that mean for me? Is that okay for me? And so based on this research, the big takeaways I'm getting is like, hey, if your shoe is stiffer, you're going to be reducing your energy cost and running just a little bit faster. So if that's what you're going for, maybe focus on something like that. If you really struggle with impact and impact-related injuries, you want to go for more of that softer shoe, something that's got a lot more of a cushion to it. And then also in clinic, you're getting these days a lot of questions about minimalist shoes. Everyone sees the big, super cushion shoes, and they're like, is that really good, or should I run something more barefooty? So that's where you're bringing in more of that education on, hey, that's going to help develop some of your Achilles, going to help improve your running economy. If you're a forefoot striker, it could be really advantageous for you. However, you do have a little greater increase of something like a stress fracture or more of your shin pain with those kind of things.
I think you can take this conversation a few different ways with patients. And when it comes to footwear, I think we need to think on a very macro level and appreciate there's a large variety of footwear out there with a variety of different intentions behind them. So if you have somebody who is getting into running, or maybe they're an experienced runner and they're looking to change footwear, it's no different than when you think about changing diet or think about changing an exercise program. You don't want to have drastic changes. So if you are 40 years old and you've spent the last 15 years running in a very bulky, cushiony, stability-oriented shoe, and then you decide overnight, I'm going to get a minimalist shoe and I'm going to run 10 miles the next day, the mileage may not be all that foreign, but the amount of support that your foot has is drastically different. So you may experience some sensations, some aches and pains because you're putting stress in areas that used to be supported that are no longer supported. Now, it may be short term, and you may just kind of acclimate to this and have a successful transition, but you do need to be aware that, yes, it does appear that shoes can influence biomechanics, and something else to keep in mind, that can be positive or negative. So I remember doing a lecture in the community with Dr. Matt Sedgley. He's a non-operative sports med physician, and he works a lot with runners, and he works a lot with recreational runners, but also some of your higher level, more competitive runners, everywhere from 5K through the ultra endurance. So he's seen it all. And he's involved with the Boston Marathon, the Baltimore Marathon. So he has a lot of running sports med experience. And I remember him saying, you're going to be the same weight, no matter what. Whatever shoe you have on, you're going to be the same weight. Whatever shoe you have on, you're going to run the same distance. So it's just a matter of how you are choosing to displace force based on your running pattern and the footwear that you have. You want to be a heel striker, get used to having back pain. You want to be a forefoot runner, you better have a plantar fascia and an Achilles and a gastrocsoleus complex that accommodate that, because you're going to have a lot of stress going through there. And he said that because it's funny, a lot of people who like your more cushiony shoes, it's people who are heel strikers and they have back pain, so they get this very, very cushiony shoe. They continue to heel strike, but at least the cushion is masking the back pain now. So you'll see sometimes is the shoe influencing how somebody's running, or is the shoe allowing somebody to run in a certain pattern because it's now providing them something they didn't have. The other thing that you'll see with that minimalist shoe, it hurts to run barefoot or minimalist and land on your heel. So sometimes the minimalist shoe, it almost just forces you to run in a certain way, or else it's going to hurt if you run the other way. So you can look at this a couple different ways, almost like cause and effect, which one is contributing to the other. But we need to appreciate that there is a correlation between the two. Asher, any final thoughts on your end, or do you think we got it all?
I think we got it all there.
Perfect. Yep. Asher, as always, thanks for doing the dirty work, diving into this article, and I look forward to seeing what you come up with next month. If you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker and Dr. Asher Roberts. Thank you.